Dear friends, this is Sharon again. Welcome to my channel. I am excited to build more friends and subscribers and get more connection with you, your input and your questions and everything else that I may miss or it may matter to you, but I haven't discussed anything on that topic. You can give topic suggestions and I will try my best. I am looking forward to doing YouTube videos and hoping to be successful in providing the information that helps us all out there, because it is very important to share what we know with others so that they may also get to understand things that they may currently not understand or know or are having difficulty with. Today I have chose the topic social determinants of health, the factors that shape our lives beyond medical care. I don't know if a lot of people know about or understand what social determinants of health is. When people think about health, they often think about doctors, hospitals, medications, and treatments. While these are important, they are only part of the picture. Research and real world experience consistently show that many of the factors influencing health outcomes exist outside of the healthcare system. These factors are known as social determinants of health. Social determinants of health are the conditions which people are born, grow, live, work, and age. They significantly impact a person's ability to maintain good health, recover from illness, and achieve overall well being. And when I say that, I would like to say that I have experienced these things throughout my career in social services and healthcare. I have seen firsthand how social determinants affect individuals and families every day. Patient may have access to excellent medical care, but if they cannot afford their medication or lack of transportation to appointments, live in unsafe housing, or have little family support, their health outcome can suffer. Now some of those outcome or common social determinants of health include housing stability, income and financial security, access to nutritious food, transportation, education and health literacy, employment opportunities, family and social support systems, access to healthcare services. Consider an older adult who is discharged from a hospital after a serious illness. Medically, they may be stable. However, if they live alone, cannot drive, struggle to afford groceries, and have no nearby family, their risk of complication and hospital readmission increases specifically and significantly. This is why healthcare professionals must look beyond diagnosis and medical treatments. To truly improve outcomes, we must understand the whole person and the environment in which they live. Addressing social determinants of health requires collaboration among healthcare providers, social workers, case managers, community organizations, and policymakers. It requires us to ask not only what is the matter with this patient, but also what matters to this patient. Programs such as Enhanced Care Management or ECM and community-based care initiatives are helping bridge the gap between healthcare and social services by recognizing that health influenced by far more medical treatment alone. As professionals, we have an opportunity and responsibility to advocate for solutions that address these barriers. By helping individuals access housing, transportation, food assistance, caregiving, support, and community resources, we are or we can create meaningful improvement in both outcomes and quality of life. This lesson is simple but powerful. Health is not determined slowly in hospitals and clinics. It is shaped by the conditions of everyday life. When we address the social determinants of health, we move closer to creating healthier individuals, stronger families, and more resilient communities. Thank you. I hope you liked my video. I hope this makes sense to you and brings a little bit more understanding to you why these things are important and why as a community we should focus on these things. And nowadays we see more and more effort put into the social determinants of health area of a person's life when they're hospitalized or when they go to skilled nursing facilities for rehab, anything like that, to make sure that after they leave hospital, after they discharge or from skilled nursing, that those things are available to them easily for them to keep on improving their health and able to continue doing what has been recommended by the professionals, the doctors, or the specialists. And most of the time, it may be that a resident just needs a transportation to get to a therapy, but they are not able to drive and they do not have anyone around them to provide the transportation. I will see in my next topic, or maybe get a little bit more into the social determinants of health to see if there are and what type of resources we can use to find a lot of these helps that is needed for these patients and also for the family members, that they're able to find these helps and resources when they need it. Thank you, my friends. Please do comment, do like the video, and do let me know what questions you have if these videos are helping you, and how I can make my videos better for you guys. Thank you very much. Have a wonderful day until next video.